Good afternoon, everyone. Thanks for joining us today for this update on our local COVID-19 outbreak trends, vaccination, and status with our phases. As of yesterday, we have surpassed the 100,000 case milestone in King County. We have over 100,480 cases reported, 5,926 hospitalizations, and 1,536 confirmed deaths since the onset of the COVID-19 pandemic. This week's forecast has unstable weather continuing, with sunbreaks possible late in the week. After 6 weeks or so of increasing counts, the number of new cases this week has decreased slightly by 5% compared to last week, with an average of 347 cases a day. Our 14-day incidence rate, which had been rising since early March, is approximately 250 per 100,000, which is similar to last week and almost double what it was at the end of our fall-winter surge in early March. It's important to note that this data are calculated with a 7-day lag. So that is from that rate, the 14-day incidence rate is based on cases from 7 days ago. Since early March, case rates have been trending up for all age groups except for ages 65 and older. The highest rates are in the 18 to 24-year-olds, followed by 25 to 49-year-olds and 5 to 17-year-olds. Over the past 2 weeks, the increasing rates have leveled off for most ages, except for 5 to 17 and 18 to 24-year-olds. And this leveling off in case numbers and incidence rates are hopeful signs, although the immediate future direction remains uncertain. Overall, COVID-19 incidence remains highest in the cities of South and Southeast King County, including Auburn, Kent, Federal Way, Burien, Renton, Tukwila, and SeaTac, Southeast Covington, Enumclaw, and West Seattle, South Seattle, Delridge, and Highline areas. These regions continue to experience double to triple the number of cases and hospitalizations compared with Central and North Seattle, Shoreline, the East Side, and Vashon Island. I want to remind everyone that our outbreak data and trends by region are available on our COVID-19 daily summary dashboard. Check the tab Geography over Time for the regional trends. As for hospitalizations, over the past 7 days, 117 King County residents were hospitalized with COVID-19, which is a decrease of 20% compared to the prior 7 days. And that is a welcome decrease that I hope is sustained, because currently 1 person continues to be hospitalized in King County every 1 hour and 26 minutes. Our hospitalization rate is 6.5 per 100,000 per week, which is similar to what it was the prior week and approximately 3 times what it was in early March. And again, I want to remind you that metric is calculated with a 10-day lag. So that's from 4/25, April 25th. The recent increased hospitalization rate trends in younger and middle-aged adults are unchanged, while the overall risk of hospitalization remains higher for older rather than younger adults. Adults 40 to 69 years of age accounted for most of the hospitalizations again over the past week. And again, over the past week, there were more 20 to 39-year-olds hospitalized than people over 70. And as has been the case throughout the pandemic, our case rates are highest in our Black and Hispanic residents. Weekly deaths remain comparatively low compared with the fall and winter surge, with 1 King County resident dying on average each day in King County, and that's been stable for weeks. Now, with respect to the phases of the roadmap to recovery, as I'm sure you all know, as announced last Tuesday, King County is remaining in phase 3 of Washington's roadmap to recovery on a 2-week pause due to our plateauing trends. During this time, the quickest way to decrease cases and hospitalizations is through limiting indoor activities with unvaccinated people, continuing to wear face masks when indoors around unvaccinated people and when in crowds, and ensuring good ventilation in workplaces, businesses, homes, and wherever people gather indoors. Opening doors and windows can make a big difference in reducing the risk. At the same time, the more people that are vaccinated, the less vulnerable we will be to future surges and severe outbreaks over time. So in summary, the COVID-19 outbreak is no longer a 5-alarm fire. but it continues to burn and has not yet been extinguished. At the moment, new cases of COVID-19 can still spark flare-ups that spread among unvaccinated people. We need to continue to fight this fire with multiple strategies, vaccines plus precautions. And as more people are vaccinated, particularly young adults and subsequently adolescents and eventually children, the risk to both individuals and to our community as a whole will continue to decrease. Remember, vaccines take a few weeks to be fully effective after completing the series. So for now, we need to continue limiting activities with unvaccinated people and taking certain precautions in order to turn this current surge around while we continue to vaccinate. This week, the World Health Organization updated their guidance to more clearly highlight that COVID-19 spreads primarily through the air, including from people who do not appear to be ill or before they develop symptoms. Everyone should know that there are important concrete steps that workplaces, businesses, and others can take to improve the air quality in indoor spaces and reduce the risk for spread of COVID-19. All King County business owners, operators, and building managers for restaurants, gyms, and other retail and indoor public spaces should review the new guidance on our website for 3 steps to improve indoor air quality and make sure our indoor air spaces are as safe as possible. And everyone who's out and about should be familiar with these safety measures and look to see that the steps are being taken to make the air as healthy as possible in the stores, businesses, restaurants, gyms, and other places that you visit. Protect yourself and those around you at this time. Limit activities with unvaccinated people from outside your home. Avoid crowded indoor spaces with unvaccinated people. Pay special attention to improving ventilation in workplaces, businesses, and homes, including by opening doors and windows. And wear a well-made, snug-fitting face mask when indoors with unvaccinated people. Now, let me speak a little about vaccines and vaccination coverage. As of this week, we passed a milestone with over 2 million vaccine doses administered in King County. 1.25 million King County residents aged 16 and older have received at least 1 dose. That's over 2/3 of people 16 and older with 1 or more doses, and 46% now fully vaccinated. Over 90% of King County residents 65 and older have 1 or more doses, and 82% of King County residents 65 and older have completed the series. For those 65 and older across all race and ethnic groups, we now have 83% or higher coverage with 1 or more doses. And for those 65 and older in every zip code in King County, we have 70% or higher coverage with 1 or more doses. So we've reduced disparities in vaccine coverage among older adults significantly, and this is saving lives across the county. However, some of the populations hardest hit by COVID-19 in South and Southeast King County and among Black and Hispanic communities continue to have relatively low rates of vaccination among younger adults. For example, when we look at the 16 and older group, 1 or more doses of COVID-19 vaccine are available. Let me rephrase that, sorry. When we look at the population of 16 and older, we have achieved 63 to 70% coverage with 1 or more doses for white, Asian, Native Hawaiian, Pacific Islander, and American Indian, Alaskan Natives, compared to 49% coverage for Black, African American, and Hispanic residents. And we also see lower rates of coverage in South and Southeast King County compared to Seattle and the East Side. So to help close these gaps, we continue to partner with community-based organizations. We want to answer questions and make getting a vaccine as convenient as possible. And we're continuing our mobile vaccination work to reach vulnerable populations, including visiting homeless service sites, people who are homebound, and senior living facilities. And as you may know, likely next week, residents aged 12 to 15, adolescents, will likely become eligible for the Pfizer vaccine. Now, our vaccine supply has increased significantly, which is great news. It's now much easier to get vaccinated than it was earlier in the pandemic. At many sites, you don't even need an appointment any longer. And we know that those who are most motivated and able to seek out vaccination have been vaccinated. And I'm so pleased by that and thankful for the protection that you now have. Now, Our efforts are focusing on serving people who have more questions or barriers to getting vaccinated. And our strategy is to make it as convenient as possible to get information and get questions answered and get people vaccinated with no appointments needed. And in order to do this, we're continuing to work with local fire departments and community groups to hold no appointment needed vaccine pop-up clinics at parks, sporting events, shopping areas, and other locations. For example, this week we had fire departments that held pop-up clinic sites at Covington City Hall and Burien Farmers Market. Seattle Fire is providing vaccinations at all the Mariners and Sounders home games. And today, the City of Seattle and the U District Partnership are providing mobile vaccinations on the Ave, including coordinating with small businesses in the area to ensure staff have the opportunity to get vaccinated if they wish. It's very understandable that some people are not yet vaccinated and may still have questions or concerns about vaccination. And I think that's appropriate. People should always understand why they get any medical treatment, and they should have an opportunity to have their questions answered when making any personal health decision, including about vaccinations. Here are a few reasons why someone who's not yet vaccinated should consider it. Although the risk of severe disease increases with age, even young adults can get seriously ill. And even if you're young, COVID-19 can land you in the hospital or the ICU. About 4 people aged 20 to 39 years of age are hospitalized every day in King County currently. And even if you don't get hospitalized, you can develop long COVID. In fact, you can develop long COVID even if your initial COVID infection was mild. And long COVID lasts for months and can include trouble breathing, extreme weakness, fatigue, joint pains, difficulty thinking, difficulty sleeping, anxiety, racing heartbeat, and many other symptoms. It can be hard to work or do the other things that you need to do. Like severe infections and hospitalizations, long COVID is definitely something you want to avoid if you can. And if you just aren't concerned about getting a serious infection or long COVID yourself, remember you can unintentionally spread COVID to your family members, to your friends, your coworkers, and others you come in contact with, because the virus spreads through the air when we breathe, talk, sing, shout, sneeze, or cough before you have any symptoms. And finally, there are tens of thousands of people in King County and millions in the US who have weakened immune systems from cancer treatment or from medications for certain diseases or for organ or bone marrow transplants. Many of these people can't get protected from the vaccine, and they depend on the rest of us to decrease the spread of COVID-19 in the community. Even if you don't think you know someone like this, there's a good chance you do, but don't realize it. So getting vaccinated is important not only for our own health, but for the health of our family members, friends, coworkers, and our community and economy. If you've been vaccinated, you can help move all of us toward community protection by helping a family member or friend who's not yet vaccinated do it. Now, it's easier than ever to get the COVID vaccine. Many of our sites are offering vaccinations with no appointment needed, including King County sites in Kent and Auburn, the City of Seattle sites at Lumen Field, Rainier Beach, and West Seattle, and many local pharmacies. And we're also offering vaccines without an appointment at public health clinics in downtown Seattle, Bellevue, and Burien. For more information on vaccine sites throughout the county, visit kingcounty.gov/vaccine. With that, I'd like to pause and welcome a discussion with you.
Thanks so much, Dr. Duchin. We'll get the Q&A underway momentarily. If you have a question, please use the raise hand function in Zoom. And before we start, I just wanted to point out that we're going to be hosting an Instagram live event tonight, sort of on vaccine myth busting geared toward young people. And that might be of interest to some media. It's at 6 p.m. tonight. Young people will be able to ask questions about the vaccine, including how it works and side effects, how it was developed. There will be prizes, and you can tune in through our Instagram page at KC Pub Health. With that, we'll get our Q&A started. The first question comes from Steve McCarran. Steve, go ahead.
Thank you, and I do want to apologize to Jessamine. I know I took her first spot that she usually has. Thanks for the question, Doctor. Looking at the state's dashboard, we've been noticing that King County continues to have one of the highest vaccination rates in terms of total population. I'm curious, now that we're several months into the vaccine rollout, what do you contribute to that number being so high? And what are some of the biggest challenges? I know you mentioned some of them, but what are some of the biggest challenges now in the phase that we're in of the rollout that the county faces, especially when vaccination rates are starting to stall or maybe drop a little bit in some areas of the state or country?
Mhm. Thanks for your question, Steve. I primarily attribute our high vaccination rate to the intelligence and the good common sense of our community. People that get vaccinated voluntarily, and no one's forced to be vaccinated, and just a tremendous testament to the understanding of our community members of the incredible effectiveness of these vaccines, of the safety of these vaccines, and of the benefit that they bring both to individuals and to our families, our loved ones, our friends, our neighbors, and our community as a whole. So I first and foremost contribute this to the great sense, good judgment, and uh, motivation of those people who have so far elected to be vaccinated. I secondarily attribute this to the essential work of all of our community partners that have delivered these vaccines to those people who have been vaccinated. And there are too many to name here, but we have partners throughout the healthcare delivery system, in city and municipal governments, and of course, our own team here at Public Health that have been working nonstop to make this vaccine available to our King County residents and to our partnerships at the state level, and also our federal government for facilitating the development of these incredible vaccines and providing them at no cost to the American people. Now, with respect to the challenge ahead, as I said, it's understandable that, with anything new, there are early adopters and there are people who want to wait and see. And our challenge now is to make sure that we do everything possible to help everyone in the county make the best decision, both for their own health and for the health of those around them, their loved ones and their community. And so we're having to pivot from of an approach that was initially very heavy on mass vaccination clinics to more tailored opportunities to allow people's questions to get answered in environments that are comfortable for them, and in trusting with trusted messengers, people who they can rely on to give them the straight truth, and to also make vaccine available to those who might not take the effort that others have shown to get vaccinated. It was quite an ordeal for the early adopters to go through the scheduling and appointing process and to seek vaccine and sometimes to travel to get it. And we now know that, and we always did, but now we know we have to make vaccine available more conveniently for certain people. And we want to do everything we can to do that. So for anyone who's got suggestions for us on how we can make vaccine available in your community or answer the questions that you have, please let us know. Gabriel can put an email address on the Facebook page where folks can send us your thoughts about how we can reach those who have not yet been vaccinated and therefore help improve the health of our entire region.
Thanks so much. And our next question is from Jessamine McIntyre. Jessamine, please go ahead.
Thank you. Tip of the cap to you, Steve. You got me. Dr. Duchin, I actually have two questions this morning. We have seen that drop in demand, as you discuss, for vaccinations across the state for a variety of reasons. How do you prevent waste at the no appointment sites without knowing how many will show up? And my second question is, how much can increased vaccination numbers perhaps help over the next week and a half in such a short period of time when it comes to the roadmap?
Mm-hmm. Thank you. The waste issue is very challenging when we talk about walk-up appointments. When you know how many people are coming in, you can take that number of doses out of the freezer or the fridge, have them ready, and then match the number of doses that are out and need to be used within a certain number of hours with those people who are expected to arrive. It's not possible to be that precise when you have walk-in appointments and never know from one day to the next how many people may come. Someday it may be a few hundred, someday it may be a fraction of that. And so we do have guidelines that we've developed for our healthcare providers on how to minimize waste. But I think we all understand that waste will be inevitable as we move to this new strategy of maximum flexibility. So it's a question of minimizing, and that would involve things like, taking out as few doses as you think are realistically going to be used, not trying not to overestimate, and then also having systems in place to rapidly either solicit people to use doses that are out and available, or to, when possible, relocate them, move them to another location where doses can be used. There was an amazing example of a clinic that happened about 2 weeks ago that had some extra doses, and they just went out on the road and put signs up for walk-up and said walk-up vaccination available, and they were able to use all their doses that were out for that day and couldn't be used again the next day. So there are a number of strategies, but I think it's inevitable that there will be an increased amount of vaccine wastage as we move to this new maximum flexibility strategy. Sorry, second question.
When it comes to the week and a half left with the evaluations, how much do you think can be done with increased vaccination during that time?
Yeah, I was going to speak a little bit about that in the closing, but in general, vaccines take a few weeks to be fully protective after the dose is completed, after the series is completed. So for a 1-dose vaccine, we're talking 2 weeks after that dose. And for the 2-dose series, we're talking 2 weeks after the second dose. So vaccine clearly is not a short-term strategy to turn around numbers, cases, or hospitalizations within a 2-week period. However, what we will see is the effect of the vaccines that are kicking in, that over the past 4 to 6 weeks, and that should help us to some degree. And then, of course, why I'm always emphasizing the need for human behavior to also be a focus, that we need to continue to limit activities and take precautions. And I will address that a little bit more in a couple of minutes.
Thanks so much. The next question comes from a member of the community who is watching the briefing on Facebook, and they ask, I've heard 2 people I'm close to who are vaccine hesitant state that the rate of deaths related to the immunization are very underreported. Can you speak to COVID vaccine related death rates? And I would add other adverse reactions.
Yeah, thank you for asking that question. There is a viral, so to speak, misinformation outbreak happening right now, some of which was started by a Fox News commentator that erroneously reported that the vaccine adverse events reporting system had thousands of deaths that were linked to COVID vaccine that were unexplained. What he didn't explain was that the VAERS system is a early warning system where anybody can report anything that may or may not be related to vaccine. So people die, particularly older people die, and every day. They die before COVID, people that will die after the COVID outbreak is over. And simply having died after you received the vaccine in no way indicates that the vaccine was responsible. The key piece of information that he forgot to provide was that among people who were vaccinated, the likelihood of death was significantly lower than among people who are not vaccinated. So the death rates actually dropped in adults who were vaccinated compared to adults who were unvaccinated. So he presented very selected, misleading facts that were intended to undermine vaccine confidence. And there are real active campaigns on social media that are intended to do just that, to undermine people's confidence. And I encourage everyone to look at the robust vaccine safety systems that we have in place. In addition to the VAERS systems, we have something called the Vaccine Safety Data Link Project, which looks at thousands and thousands of people that are enrolled in health maintenance organizations all across the country, monitors those who have been vaccinated and compares them to others who have been unvaccinated, and looks for signals, any sort of worrisome health events that may be happening at increased rates in vaccinated people. And we are not seeing any major safety signals at all related to these vaccines. You're aware of the Johnson & Johnson signal that was picked up just a small number of cases, a handful, through this VAERS system. It was studied, it was found to be real, but very rare. And of course, we know the benefits of the vaccine outweigh the risk of this rare side effect, but it should be reassuring to all that the systems did pick these up. And when you talk about things in the 1 in a million range, it does take quite a while to find these. They're not easy, obviously, they're incredibly rare, and they're low risk. So the rumor about people dying, thousands of people dying after they got vaccine, was intended explicitly to discourage people from vaccination and undermine vaccine confidence, and is in no way based on real events.
Thank you so much, Dr. Duchin. Next question comes from Will James. Will, please go ahead.
Thanks, Dr. Duchin. This question might dovetail somewhat with Jessamyn's second question, but slightly different. I guess, given King County's relatively high rate of vaccination, approaching 70% of people over 16 with one shot, and given what we know about how even one shot offers significant protection, and a lot of people now are fully vaccinated, are you surprised that our cases in King County have not seen a more significant decline by now? And do you have any ideas about why cases remain stubbornly high given the vaccine coverage?
Yeah, well, these are great questions, Will, from you and Jessamyn on this. And I am going to talk a little bit more about that in a few minutes.
Sure.
But we do have very high vaccination rates, but we also have subgroups in the population that remain less vaccinated. And COVID can continue to spread quite effectively. As a matter of fact, as effectively as ever, and with the new variants, more effectively than ever, in groups that are currently unvaccinated. So what we're seeing is not disease among those who are vaccinated. These cases and hospitalizations are occurring among unvaccinated people. And I will say in a few minutes more about this.
Thanks so much. Next question from Will Stone.
Hi, Doctor. Are you encountering any kind of drop off in interest or hesitancy around the Johnson & Johnson vaccine after the pause?
Well, funny, just this morning I heard that we had a recent clinic where there was enthusiasm and a specific request for that vaccine. I haven't heard from our team, and I am not aware of any data that suggests a specific drop-off in interest in the J&J vaccine. Now, it's important, that everyone who is considering that vaccine is aware of the rare but serious side effects, and also the benefits of this vaccine. And particularly women under 50 should understand this risk, and that there are other vaccines available. But this vaccine also holds many attractive features, such as one and done, a single dose, and very easy to administer based on its storage and handling characteristics. And it's very, very, very effective. So no, I haven't. And I will double check, and we will get back to you if there is anything that I'm not aware of, but I don't think so.
Our next question comes from Nick Popham. Nick, please go ahead.
Hi, thanks so much, Dr. Duchin. Excuse me. So my first question is, now that Pfizer is kind of seeking that full authorization compared to the EUA, do you think that'll make people feel more confident in getting vaccinated with Pfizer if they get this full authorization? And then kind of what the difference are between EUA and full authorization? And then the second question is, there's been a few calls to reopen by June 15th. I know California is doing that. I was kind of wondering your thoughts on setting a timeline for reopening, given where we are right now.
Okay.
Thanks.
Yeah, so with respect to emergency use authorization versus full licensure. Full licensure is a slightly different process that requires a little bit more long-term observation of patients. And so it's up to the company whether they want to apply for full licensure. I think most usually do. And I think for those who have any reservations about the process, that may reassure them. And I would hope that at that point they would have feel more comfortable getting vaccinated if this is the reason, the emergency use authorization that they were holding back. Now, the difference is not great. I mean, the emergency use authorization had safety benchmarks set up by the FDA. It required, an average of 2 months of observation post-vaccination. Now there are more months of observation, and there are more people that have been observed over time. And of course, we've been monitoring for adverse effects all along. So there will be no surprises in this new licensure, other than the fact that it will have gone through all the administrative loopholes that are not loopholes, all the administrative requirements that any vaccine does. So yes, I hope it, if there are folks that were not comfortable with the emergency use authorization, despite the fact that that really did not compromise the safety of the vaccination, that they will be further interested and come forward. And I imagine that Moderna vaccine also will ultimately have full licensure, as will Johnson & Johnson and others. With respect to full opening, this virus is difficult to predict where we're headed. And of course, we are in a place, I think, now with vaccines where we do have the opportunity to as I said, change this this outbreak from a 5-alarm fire to a smoldering, manageable situation. And what that means is that, I think some of the guidance, the restrictions will be less sort of population-focused mandates and more personal risk decisions. And I think we are reaching a point where that type of transition, from imposed limits and restrictions on activities to people understanding that, when you gather with others who are unvaccinated, you're taking a risk of COVID-19, which is can be a very serious disease. But in a situation where our population largely will be protected, and therefore, the interest of the state in compelling people to take certain actions to protect the community at large will be progressively lower over time. I don't know what the right date is for that. I would like to see our cases significantly lower than they are now, if possible, before we went to that transition, because it's just not a great thing to have someone hospitalized every hour and a half with a potentially very serious and life-threatening disease and a death a day. But we are going to have to come into an equilibrium with this disease as a community. It is not a decision for any individual to make. It's not necessarily a scientific decision. It's a decision that's based on values of our community as a whole, including public health people, including our elected leaders, our citizens, our business community, et cetera. We all will need to weigh in on where that equilibrium lies, what level of illness, hospitalization, and death we are willing to tolerate in order to get back to our full activities. And so going forward, I think we will want to continue to liberalize activities as long as vaccination rates continue to go up and cases go down. But where that exact, threshold is that we decide we're going back is not something that I can, it's not a scientific decision. It's a political, economic, and community values decision.
Next, we have another question from a member of the community from Facebook Live. And the question is, can you clarify something about transmission of the virus on surfaces? While less likely than airborne transmission, is it known how likely and for how long the virus can be transmitted from a surface that has been contaminated with the virus?
Yeah, it is. And it all depends on what type of surface, whether it's a hard, smooth surface or a porous surface, and whether it's indoors or outdoors and what the environmental conditions are. There's a very good science brief on the CDC website on transmission of SARS-CoV-2, which includes all the modes of transmission, most common short range, close contact, the air, and also through droplets that can move when someone coughs or sneezes. They don't float in the air, but they just, like cannonballs, can hit you in the face and land in your eyes, nose, or mouth, or you can breathe them in. And then least common would be surface transmission. So I would encourage you, because it's a complicated area, and the virus can survive for a matter of minutes to hours, depending on the conditions and the type of surface, to look at that brief to get the full answer to your question. But in general, just because virus is found on a surface, again, doesn't necessarily mean that it can be transmitted or acquired. When you touch that surface, it has to then move from the surface to your hands, and then from your hands to a part of your body that would allow it to invade. So for that reason, contaminated surfaces are considered to be a potential but low risk for COVID transmission in most settings. But where there are known COVID cases, where there are people who are known to have COVID, especially in medical or congregate settings, it's more of an issue. Contamination is more likely. But in the general public, where relatively few people in any one location have COVID, and where a virus that was deposited would be likely to be on a surface for a relatively longer time, and all the other things that have to happen just right for that to transmit, the risk is pretty low. I still recommend people use good hand hygiene and clean surfaces, in a way that you would routinely clean surfaces in your home and in your business and so on, particularly frequently touched surfaces. But the initial emphasis on disinfection and decontamination and hygiene was probably overly cautious. It was definitely overly cautious and more than what was needed.
Thanks so much, Dr. Duchin, and we'll share the link to that CDC science brief both in Facebook and here in the chat for media. Our last question is from Kate O'Connell. Kate, please go ahead.
Hi, thank you for this briefing, Dr. Duchin, as every week. Just wondering if you could speak a little bit about the upcoming expected approval of vaccine for 12 to 15-year-olds. Vaccine hesitancy among parents has been an issue in this area in the past when it comes to vaccinating children. Just wondering if you could go over kind of what you're expecting to see with that younger set becoming eligible, and also if you could talk about why it's important for that younger set to be vaccinated, even though it's a lower risk of disease and death.
Sure. Well, I guess what I would expect to see is similar to what we saw with adult vaccination. There are a whole lot of people who are interested in having their children vaccinated. And I know there are a whole lot of children who want to be vaccinated. They don't want COVID. They've been following the situation quite closely. And then there will be those who are more hesitant, who want to wait and see who gets vaccinated, see how they do. And then there will be those that will take even longer to understand, to reach a comfort level or not. We know that with our other adolescent vaccines, there are a large number of people, the majority, just like adults, who seek vaccination for their children and for things like HPV vaccine and for the meningococcal vaccines, the other adolescent boosters. But there are some, who are more reluctant. And I think that we'll need to use the same strategies and approaches that we use for adults to answer questions and reassure people about safety. And of course, Wednesday's ACIP meeting will present a lot of this data nationally, both the safety data, the rationale, and and what we should expect with respect to vaccine supply and when for the 12 to 15-year-old group with Pfizer. I think, people understand that adolescents and children are much less likely to be hospitalized and to die from COVID. It's very unusual, but it happens. Adolescents can spread the disease, as can children, to one another and to adults, less effectively than adults do, but they do it quite effectively, and they can spread it to one another. And so, we don't like, I think many of us don't like our children to be sick. Our children don't like to be sick. We value healthy children. We value healthy schools and childcares and places where kids can congregate. And we value the protection of even a small number of vulnerable children who would be susceptible to the severe outcomes, hospitalizations, rare death, and the rare multi-system inflammatory syndrome that can occur with COVID-19. So it's a very common disease. It's going to be a common disease in children. It's going to be occasionally severe. Children can spread it to one another and to adults who can develop severe outcomes, and it's highly preventable. And the vaccines are extremely safe. So I think those are, in a nutshell, the rationale and the reasons why people would be interested. We'll see. I think over time, it's brand new. It's understandable. People will have more reluctance than they would with something they're familiar with, like influenza vaccination for children, for example, which we recommend every year for all children 6 months of age and older. And as you know, influenza is not a major killer of children, but several hundred die. Hundreds of children die each year on average due to influenza. COVID so far has killed more children than influenza, but we'll see what happens on a year-to-year basis. I think both diseases will be variable in how they affect different populations each year, but it's comparable or more severe. And I think we value protecting our kids from diseases like influenza, and I think we'll value protecting our children from COVID and protecting those who our children might spread COVID to in so doing.
That's going to conclude our Q&A portion, and Dr. Duchin, we'll just throw it to you for your closing thoughts.
Well, thanks again, everyone. I really look forward to our sessions together. I just have a few closing comments. We are currently in a pause with respect to phase 2 restrictions that make sense based on our disease trajectory. After we release the pause button, I want us to be able to push play and not rewind. Our outbreak continues to smolder, but with increasing vaccination coverage, we will see a decrease in the risk of COVID-19 cases, hospitalizations, and deaths, and fewer large outbreaks that disrupt our workplaces, our schools, our economy, and other activities. The end game with respect to the way the pandemic will play out over the coming months and years is not possible to predict with certainty. In my opinion, COVID-19 is not likely going to disappear suddenly, but gradually, likely with fits and starts over a period of years, and flare-ups will still be possible in populations with low vaccination coverage or with unanticipated changes in the virus. COVID-19 outbreaks will likely continue to occur intermittently among unvaccinated people, but these should not lead to large outbreaks in a well-vaccinated general population. Vaccination is the most important thing we can do to reduce our risk now and in the future, and the speed with which we can return to normal and the extent to which we will need additional precautions depends on how many of us get vaccinated and how quickly. To the extent that we can work together to increase vaccine uptake in the community, we will all benefit. And finally, to paraphrase Dr. Duncan Ryukin Williams, a Buddhist monk and chair of the University of California School of Religion, with respect to COVID-19, like so much else in life, we are interconnected, we are interlinked, and our destinies are very much intertwined. So with that, I thank you again for joining us today, and I look forward to seeing you next week.
Many thanks, everyone. And thanks again, Dr. Duchin.